In our last episode, I talked about therapeutic foods that we include in our meal plans for hypertensive patients. Today, I want to focus on the kind of foods we like to remove from the diet of hypertensive patients. Sugar would be number one on the list because of three reasons. Sugar is metabolized into triglycerides. These are fats that usually you'll see raised in your biomarkers when you have hypertension. Secondly, uric acid may also be raised when you're consuming sugar in high amounts. And last but not least, insulin resistance is also a concern when you have hypertension. Uric acid, as I mentioned earlier, stiffens arteries, and when we have stiff blood vessels, we end up with high blood pressure. Triglycerides, on the other hand, are not a very good biomarker we have because these are associated with further complications on our organs, the main one being our liver. You're likely to get a fatty liver as a complication of high triglycerides. And then, as we saw, insulin resistance also damages blood vessels and leads to the formation of atheromas. And as we saw, atheromas stiffen arteries. They reduce the lumen size, and when they dislodge, they may cause stroke. They dislodge in the brain. They may cause myocardial infarctions when they dislodge in heart tissue or in heart blood vessels. Then sodium, that is just salt in layman's terms. We try to limit to 2,000 milligrams. That is like a teaspoon. You should preferably reduce it to 1,500 milligrams. Sodium, as we saw, also causes injury, direct injury to blood vessels if it's in excessive amounts. Then oils. Oils are a big deal when we are dealing with hypertension in its various forms. We have the highly refined oils, especially from seeds and vegetable oils. Examples of these include corn oil, vegetable oil, regular salad oil, highly processed sunflower oil, and soybean oil. These oils are highly inflammatory in the body. And another oil that we would be concerned about is margarine and trans fats in highly deep fried foods. These foods irritate the body in such a way that the body ends up excessively producing inflammatory byproducts. These inflammatory byproducts will usually overactivate what we call our innate immune system. And when our innate immune system is overactivated, it releases certain materials, biologically active materials that damage many organs beyond the blood vessels themselves. They'll damage your eyes, they'll damage your kidneys, your livers, your muscles, your skeletal tissues, and so forth. And so when we have a client, we like to alter or change the type of fats in their diet. And this involves both the cooking fat, introducing the healthy fats, such as in almonds, walnuts, nuts, groundnuts, and so forth. And of course, fatty fish. Then we have caffeinated drinks. High amounts of caffeine will usually increase your cortisol level. Cortisol is a stress hormone, and this is associated with an increased heart rate and abnormal heart rhythms. Last but not least, alcohol. We pay attention to alcohol. We'd like you to reduce your alcohol. We really do not have safe amounts of alcohol, although sometimes we may come across recommendations that are best analyze at an individual level. Alcohol, because one of the byproducts of alcohol is uric acid. As I have explained before, uric acid stiffens your arteries. Alcohol is also metabolized to triglycerides. These are fats, and when you have raised fats, the main question we ask is, how much alcohol are you taking? How much sugar are you taking? So we want your alcohol, your triglycerides, to be low for many reasons. And then alcohol directly damages your endothelium. That is the inner lining of your blood vessels. And as we have seen, when the endothelium is damaged, atheromas will form as a protective mechanisms. There are many more foods, but these would be the main ones that we pay attention to. Thanks for listening. In the next episode, I'll talk about herbal medications and spices, culinary spices that may be used to reduce hypertension. It's goodbye for now.